So you know the president has said that he wants to vote on the extension of your payroll tax cut before everybody goes home for Christmas, right? So now House Republicans have put out a new plan for that to happen. Some Democrats have already flat out rejected this plan. In the plan is an attempt to tackle the so-called doctor fix, okay? If they don't fix what Medicare pays doctors, because they've taken a cut, that would mean that your doctor would get a 27% pay cut in the new year. So your doctor would be making a whole lot less money come 2012 if they don't fix this thing. Wyoming Senator John Barrasso is vice chairman of the Senate Republican Conference, and he supports this bill. He also supports it because he's an orthopedic surgeon, no doubt. Dr. Senator, good to see you once again. Welcome.
Thanks so much for having me.
So
Thank you.
Basically, there's a couple of elements in this payroll tax cut. It's like the big jobs bill that we heard about first has whittled down to these measures that they're trying to get through before the end of the year. And it would be the payroll tax cut, which would allow everybody to continue to see that money in their paycheck. The doctor fix, which would allow doctors to continue to see that money. And a couple of other elements, including extending unemployment benefits into the new year. So what's your idea on a way that would make this work?
Well, I support this tax relief for working Americans. With the issue of the doc fix, I mean, let's take a step back and remember that the president's so-called health care law didn't actually fix paying doctors. And we know that the president's health care law took $500 billion away from our seniors who are on Medicare, not to save and strengthen Medicare, but to start a whole new government program for other people. That's why this law continues to be so unpopular. And this so-called doc fix is a way to deal with some of the accounting gimmicks that the president used in the health care law to say that the law paid for itself. But it didn't pay for doctors to take care of patients. And if you think about people on Medicare wanting to see a doctor, it's going to be that much more difficult for that patient on Medicare to see a doctor if the doctors are going to be paid so much less.
Right. Understood. And we did the doc fix the last time around, so this is a question of how to extend it. But what's interesting to me is how you want to pay for it. How would you pay for it?
Well, I agree with the Simpson-Bowles approach, and it's something the president actually supported previously this year. I talked to the president about it at the White House. And it's to end some of the subsidies for the wealthiest Americans who are having their Medicare subsidized way in excess of what they're actually contributing, and they're being subsidized by American taxpayers. And we can save about $31 billion by allowing many of the wealthiest Americans to just not have the subsidy.
So, you know, this is part of a big conversation about benefits in this country. And you hear the president on the one hand saying that, you know, he wants to increase that highest tax bracket a little bit because, as he said many times, Warren Buffett shouldn't pay less of his salary than his secretary does. So you would think he would be on board with this because Warren Buffett doesn't need to get, you know, a check in the mail from Medicare, right?
Well, I think that we shouldn't, in economic times like these, raise taxes on anyone. But I also think hardworking taxpayers ought to not be subsidizing people for services like Medicare, the people who don't really need those subsidies. I think there's a lot of savings that we could have that way.
Yeah, means testing for benefits in this country is a big conversation a lot of people think we need to have in a serious way. Dr. Barrasso, Senator Barrasso, wonderful to see you again. Thank you so much for being here today.
Thanks for having me.